have. So electromagnetic frequencies markedly impede people's performance, from adults to children. We want to try to reduce that. So if you know that at nighttime we repair the desk, our body can actually recover a lot of illnesses by getting good quality sleep. So your sleeping sanctuary is very important to maintain. That digital clock that everybody has next to their bed is sitting there and blinking at you. If it's yellow, it interferes with your melatonin. If it's red, it wouldn't be so bad. But it shouldn't be there to begin with, because it's emitting out EMF. A lot of people have their cell phone charger next to their bed. They have their, some people are so sensitive because their bed sits in the room. There's an electric socket on the right, and then behind their bed, and then to the left of their bed. So that arc of electric current causes the people not to sleep well. And some people do so well as to shutting off the circuit panel the night before. Some people take the Wi-Fi out of the house that night. Don't build your autistic child's bedroom right over the main input of your house for the electrical current. You can't do everything, but all these things are easily manageable by reducing the environmental load. You may find a way of enhancing the therapies that you're all doing to help your children out. Try not to use wireless baby monitors. I mean, that's horrendous. You want to keep an eye on your kid, but those things are emitting bad items, so you want to try and do as best you can. Don't use microwaves. The compact fluorescent lights that have mercury inside there, we don't really like those items too much. Cell phone use at home. Don't put a laptop on your lap. I mean, keep them away from the computers as much as you can. Take a computer out of their bedroom if you have that opportunity. But really, you should try to minimize some of the bad points here. Louis Pasteur on his deathbed said the microbe is nothing, but the terrain is everything. The terrain is how our body is working, what is affecting us, and how can we repair it. As a general rule, it is found that patients suffering from chronic diseases, such as multiple sclerosis, ALS, autism spectrum disorder, Lyme disease, chronic fatigue, Epstein-Barr, cancer, etc., have both a high body burden of pathogens, molds, viruses, parasites, as well as a high body burden of toxins. And we need to think about what is causing the problem. There's a huge connection between Lyme and autism. And there's a probability that mercury, as well as lead and other ones, are major effectors, but mercury being the most toxic effect, affecting recovery. And when dealing with most chronic diseases, the presence of toxins deleteriously impacts our overall health and the ability to recover. You need to fix the terrain. The group that is misdiagnosed, Lyme disease is a tick-borne disease. The tick will go on your body and suck in the blood from the person or the animal, and then unfortunately vomits its stomach contents underneath the skin, and now you've been contaminated with anything that tick has been feeding on. And as you'll see a long list in a minute of all the various things ticks carry in their mouth, it is surprising how bad it is in this world. And the problem with it also is that the lab tests for Lyme disease are erroneous in about 92% of the time. They're extremely unsensitive to Lyme. And you may think, well, we don't have a big problem with ticks in Egypt or in this part of the world, it's too hot. As you'll see, there are other ways of getting tick-borne disease, stinging insects such as spiders, or lice, or mosquitoes. But because these newborn children behave so improperly, and no one thinks this is a tick-borne disease that can be contributing to it, and if they do the tests, and the tests are erroneous most of the time, no one thinks about looking further as, is it a tick-borne disease that's contributing to it? And there is a Lyme autism connection. A lot of times these kids are labeled ADHD or autism. And a lot of similarities are noted that they have methylation problems, and they have problems with sulfation defects in their biochemistry. And they're extremely sensitive, both of them, to heavy metals, pesticides, food allergies, electromagnetic frequencies, and GMOs. The United States is terrible on GMOs, and I believe also in this part of the world. And genetically modified organisms put into the food to make the food last a little bit longer is now becoming a big problem in the world. And in Europe, we cannot send our food over to Europe or to China or to Russia or to Australia because they will not accept GMOs in those countries. And it's a lot smarter. I wish we'd have that in the United States. But I'll get into GMOs a little bit. But both have been dramatically affected only if you rid the body of toxic metals, and if needed, administer a deep oxygenation program to allow for the body to recover and allow for the neurologic swelling to go down. So why is it so difficult to find in Lyme? And I'm just going to do a couple slides on Lyme. I know you don't have a big problem with Lyme disease here yet, but you probably will eventually. The antibody productivity is really compromised in people. They do a blood test on it to do an IgM or an IgG lab test to find out if you have Lyme. Well, you may not have an immune system that makes antibodies, so how are you going to detect Lyme disease if you have an immune deficiency to begin with? And then the test is considered a Western blot test, and a negative Western blot does not mean absence of disease. And the other wonderful feature about Borrelia is it can be sexually transmissible, it can be transmitted through the placenta, it can be transmitted in breast milk. And the tick does not just give you Borrelia, it gives you a whole host of terrible agents. Then when we have the spirochete, and it gets exposed to antibiotics, the antibiotic causes the spirochete sometimes to make a little cystic form. And the cystic form is not treated with typical antibiotics. You need to use metronidazole or Tindamax in order to get rid of that, or Artemisia or other agents. So you have to treat various stages of the Lyme bug. And then we have problems there with leaky guts. We have problems with biofilms in autism, which markedly impairs the absorption of good nutrients and gets the GI tract working well. We need to use certain nattokinase, apple cider vinegar, citrus pectin, digestive enzymes, etc., prebiotics and probiotics and paramount to get the gut biofilm broken up. We need to restore the methylation defects and improve the vitamin deficiencies. There are a couple papers that were written by Dr. Nicholson on the evidence of mycoplasma, chlamydia, pneumonia, and HHV6 co-infections in the blood of patients with autism spectrum disorder. These are agents that are found in tick-borne disease as well. Dr. Bransfield did a topic on the association between tick-borne infections, Lyme borreliosis, and autism spectrum disorder. And as you can see further down, another two articles, chronic bacterial and viral infections and neurodegenerative diseases and neurobehavioral diseases, as well as preventable causes of autism, the relationship between chronic infectious disease and neurologic outcome. So it is out there. The literature supports the fact that tick-borne disease contributes to diagnosis of autism spectrum. And these are some of the infections that we find in the lovely mouths of these ticks. And then people say, well, we don't have a lot of deer around here, so we can't have that much tick problems. Well, in the States as well as throughout the world, the tick, from a deer tick, likes to hop on the back of a bird or a mouse or a rodent. So any place a bird can fly or a mouse can crawl, you can get a tick-borne disease. So I tell my patients, when you go downtown New York City and Columbus Circle and I have a rush hour, you can get a tick-borne disease walking across the street because it's all over the place. Ticks are tremendous in New Jersey and in these states right now. And it's really scary because this whole host of list of pathogens can be extremely deadly and at least pathogenic to the patient and affect their life tremendously for many years. If it's not treated properly, and it's not easily diagnosed. So there's a few more slides on ticks and we'll get back to autism. I'm sorry, I just think this is important for you to be aware of. These are the size of these ticks that we have in the world. They love to tell people to use deep wood dog or some insect block on you so you don't get mosquitoes on you. That has DEET, that's a neurotoxin. Why would I want to put a neurotoxin on a developing brain in a small child? So there are natural products that are out there, eucalyptus oil with citronella and orange peel that are very good to avoid tick-borne disease and mosquitoes. Don't use DEET and don't go walking in the woods where there's a dead tree sitting over there because I'm sure there's tick-borne disease within there. Only 20 to 40% of the tick cases actually have this rash. This is classic for it. And just so you're aware, 22% of the stinging flies and the mosquitoes in the United States can carry Borrelia, which is very scary. People get mosquito bites all the time. In Southeast Germany and Eastern Europe, 12% of the mosquitoes carry Lyme disease. And many spiders, fleas, lice, and other stinging insects can carry the infections as well. And as I said before, it can be human transmission. Well, as you all know, in autism, the big problems we have is problems with communication, problems with socialization and behavior. And that is usually the center of problems we deal with on a daily basis when we try to take care of these children. We have to fix their terrain. We have to get their oxidative stress under control, their rusting of biochemical reactions that are occurring. We have to improve their detoxification, and we have to reduce their inflammation. And one of my favorite ways of reducing inflammation is by using fish oils of a good quality product like speak kids initially to get their speech to work. And one of my other favorites for inflammation is the mild hyperbaric oxygen that we use, as well as improving the immune system, which you'll hear further discussion as time goes on. But the idea is to get that methylation cycle to work with methylfolate or methyl B12 to allow our body to make glutathione, to help them detox through various forms, to allow them to make glutathione. And this is how we work. One of my favorite mentors, and if you do a lot of research and reading about autism, Sidney Baker is probably the father or the grandfather of autism care in the United States or probably the world. He's written a number of books. He's a brilliant Yale graduate, 84 years old now. We call him the White Wizard for short, because he's just a charming man. He has I borrowed this slide from him. He talks about the tax laws. This is common sense. If you're sitting on a tack, it takes a lot of resveratrol to make it feel good. But the appropriate treatment for tack sitting is tack removal. Don't just put a Band-Aid on the problem. Take care of the problem by finding out what it is and then remove the tack. And if you're sitting on 2 tacks, removing one does not produce a 50% improvement. Chronic illness is or becomes multifactorial. Think about all the various options that we've mentioned. How do we get our autistic children back? We have to break the gridlock, interrupt the vicious cycles and restore normal function. Find out what the dietary and environmental stressors are and get rid of them. Also their nutrition. Treat them for various infections. We talked about tick-borne disease, but strep and mycoplasma are huge in this topic. Relieve the inflammation we have, improve the broken biochemistry and immune function, detoxify. Hyperbarics are so helpful. And again, ABA and speech therapy is so important, and physical therapy throughout the entire process. But it's a fixing of the terrain, multifactorial way that has to occur in order to reduce some of the problems and get autism to be reversed, because autism is curable and reversal is there. We've had patients lose their diagnosis. I'm sure many of you have as well. But the world around us is now learning how to take care of kids on the spectrum. And again, I learned so much at going to those MAPS conferences, which is twice a year. I'm on the faculty there, and it's fantastic when we get people from all over the world to come and learn how to reverse autism. If we look at, this is gastrointestinal pictures that are taken from a scope on a regular, for patients. We look at lymphonodular hyperplasia on the left, and chronic ulcerations of the GI tract on the right, in the middle, and the normal gut with inflammatory disease is seen here. Nice smooth area. This is inflammation. A lot of kids usually see a child come into the room and they're leaning with their belly on the couch, or they're leaning on a table, putting pressure on their stomach, lying on the floor on their stomach, with their hands on their belly. They're in pain. They're bouncing against the walls. The traditional people who don't know how to take care of him, oh, he's just autistic, he's behaving that way. No, his gut has inflammation like this. He's in a lot of pain. They probably have a yeast overgrowth. They probably have some Clostridium difficile in there. They haven't found out. They probably have a major problem going on. When you have lymphonodular hyperplasia, you have big problems in your intestinal tract, and these kids are so much in pain. And no one recognizes it. They just see how these kids are autistic. And until people get trained on how to recognize the behaviors and how to treat them, we don't win the battle. This is a case on hyperbaric oxygen in an adult, where this person had Crohn's disease, and he had a huge ulcer in his intestinal tract. This area, he's had major amount of bleeding, multiple transfusions needed, and they were ready to take his colon out completely. So instead of having a total colectomy, they said, let's try hyperbaric oxygen. And this is at 2.4 atmospheres, and he had, I believe, 22 treatments that was done, and he healed his ulcer. And a lot of people say hyperbarics doesn't work. Well, there's so many cases where we've seen a lot of people. In my office, with the low pressure, we've had amputation potential that we've reversed. We've had MS patients not going into a wheelchair. We've had a number of patients to be improved, even with the mild units, which we'll talk about as time goes on here. So we don't want to get stuck in one of those vicious cycles that we don't know how to get out of the whirlpool. We want to continue to find, hey, if it didn't work, let's try something else in our toolbox. One of the guys one of the doctors who's a specialist in Lyme disease talks about, hey, we have a person with chronic Lyme, he has 16 nails in his foot. Pulling out 2 or 3 of them is not going to cure them. You've got to find out how to get rid of all of them. Get the immune system working. Find out what is the causative problem. And if you don't consider heavy metal burden as a huge problem, you're missing the boat, because there's a tremendous problem with heavy metal burdens in the United States on kids, and I'm sure throughout the world. So is there a link? I know I briefly mentioned vaccine. In 2009, the rate of autism was 1 out of 150, with 1 out of 94 being boys. 1 out of 94 kids in New Jersey, 1 out of 60 boys. In 2012, we're up to 1 out of 88 kids in the United States, 1 out of 49 in New Jersey. Utah, everybody thinks it's a beautiful, clean area. It is, but it's a lot of mining going on in Utah. So there's a problem with water pollution and air pollution there. 2015, 1 out of 68 kids. But in South Korea, it's 1 out of 28. Why would you say that? Why would you think in South Korea we have such a big problem? Well, in South Korea, they dump all the computer parts. And these kids are actually trying to melt the transistors off and breathing in all the lead and the mercury as these computers are being broken apart. And we have a huge amount of autism there. I don't know what the rate, you know what the rate in Egypt is, what they determined? No accurate statistics. Especially after the revolution, yeah. Right. But it's amazing how much this pandemic is growing. And again, it's not because we're better at diagnosing it. I'm sorry. I can't believe that. It's, again, where are the 30-year-old autistics? We don't have them. We have 2 15 to 20-year-olds. In the States, we now have to give 54 vaccines, over 40 shots of 16 different viruses. In the United States, I hope you don't have the same situation here, that you have to give a 2-month-old a DTP, which is 3 viruses, and a injectable polio, an HIV, a pneumococcal, and a flu shot, and a hepatitis A. There are 8 viruses that these kids get at 2 months, 4 months, and 6 months of age, according to the American College of Pediatrics. It's absurd. You need to give all these kids all these vaccines at the same time. Why can't you separate them out like Europe does? I think this is a big problem. We still do give a child a hepatitis B vaccine the first day of life in the United States, in case they're having sex with maybe the next bassinet baby to try to prevent sexual transmission disease. But there's no reason to give a hepatitis B vaccine unless the mother has hepatitis B. Why do they do that in the States? Is it because the hospital wants to make money? Probably. But I don't see any other reason why you need to give Hep B the first day of life. When they've got hyperbilirubinemia, their liver's not working, let's give them some aluminum and some formaldehyde. Or in the old days, it had mercury in it, which we'll see as a adjuvant. A study came out that for every 1,000 pounds of mercury released in the state of Texas, the autism rate increased by 61%. This is huge. There's an environmental link to this disease. Study upon study will show this. This is the autism rate, 1993 to 1990, based on the counties and how much autism we had in those years. And look at the graph, and it changed a few years later. So this is the autism rate going up, and this is the amount of volatile, toxic levels in these counties. And you go back to where is the problem, and that's where the autism is. We need to avoid having tunnel vision in this disease. There's not one cause. We need to think outside the box as to what is causing my child not to improve. And if we can figure out what method is going to reverse our child, then we win. Sid Baker always talks about the thumb sign. You give a therapy, if the thumb goes up, the kid's doing better, that's good, continue that therapy. If the thumb goes down, change the therapy, find something else. But you always want to continue, very practically, what's going to help my child? Did he respond negatively to this product this time? Come back to it later on. Fix the body, and then go back to it. Because we know that zinc is so important. We know that P5P, P6 type is